Good evening, everybody. I hope you can hear me.
Good evening.
Yes, we can hear you, boss.
We can hear you.
Thank you. Welcome to this presentation. Joel, can you get rid of this one for me? Move it over.
Thank you.
Put it quiet.
Anyway.
Okay, good. I think it's about time we start. We waited for about 10 minutes. And maybe we should wait another 2 to 3 minutes and then we can kickstart. So good evening once again, and welcome to our maiden presentation on our new platform, SpectraCare. This presentation, we are going to have 3 main segments. Initial introduction to the platform, our new telemedicine platform. Then we'll look at how, for doctors and providers, we build a thriving business. And then also we look at the economics of what we are doing as healthcare providers. So I'm going to start off with the initial introduction. I'll be followed by Paulina to identify one of the main key areas we want to highlight in this presentation. And then we have also another presentation, all part of the first segment, that will look at how to sign up. So I'll begin with mine, and that is looking at improving access to health. I keep saying that when COVID struck in 2020, it came with a lot of burden, death, worry. But out of COVID came a lot of positives. And one of the positives is the digital space, which has expanded not only within the financial areas, but also in healthcare. With our healthcare approach to the tech platform is telemedicine. And that is what we are going to talk about today. We're going to demonstrate our solutions, which is very comprehensive and cuts across the use of urgent care, chronic disease management, as well as the use of integrated devices. I'm going to demonstrate the different packages and how as healthcare professionals can develop and make this the next phase of our care. I'm sure within the next 5 years, telemedicine will form a greater part of our lives. And we are happy to be one of the pioneers in Ghana. I'm sure we all know what telemedicine is, and that is reaching patients at their convenience, using mobile gadgets to be able to access health. And I think one of the main importance of telemedicine is also to give access to people within the rural communities who are usually inhibited by way of transport, as well as even access to certain specialists because care is not available. We all know the definition of health, and it's not just a well-being by way of physical, but mental as well as emotional and social well-being. And telemedicine is set to revolutionize the way we access healthcare as well as get healthcare delivered. Traditionally, I think it's been started off telemedicine usually with audio, phone calls. Now the tools have increased from just phone calls to video calls, text messaging, as well as now we have telemonitoring. It even includes in certain jurisdictions able to monitor patients within the ICU. So this one is maybe one of the basic telemedicine approaches we are taking. Now, apart from the traditional evaluation of patients, telemedicine now is able to treat urgent care for patients who come on with one-time disease, as well as able to manage chronic diseases like diabetes and hypertension. And I'm going to go through it well, how this our platform is able to do that. Mental health plays a huge role, and I think most telemedicine practices started with that because it didn't require a lot of clinical evaluation by way of vitals. So that has been a long time approach to telemedicine. And then, of course, as I said, with the integration of digital diagnostic and monitoring devices, it's even become better. So what do we have on our platform? We are able to do video and audio consultation as well as text consultations. We have teletherapy, and that pertains predominantly with the mental health services. On the platform, we are able to do e-prescriptions. So you can actually get professionally written prescriptions, which can be sent directly to the pharmacy. In the upcoming engagement over the next 6 months, it is possible that you can order the prescriptions online to be delivered at home. Then, of course, we have our remote monitoring platform where you can use technology to take the vitals, and that include blood pressure, blood sugar, oxygen saturation, temperature, as well as even do ECG. And we show through what we have on the platform. Clear telemedicine benefits include convenience, and that means that doctors don't have to move out of their homes to go and see a patient. In the same way, patients can receive care in the comfort of their homes. Access and barriers. So we have, for example, certain specialists in certain jurisdictions. Let's say we take a neurologist or cardiologist. There are few in the country, which means that people living somewhere in Paga, it will cost them a lot in terms of time, as well as money to travel down south to see a neurologist or cardiologist in Accra or Kumasi. So in terms of delivery and overcoming barriers is excellent. Now, what we also know is that telemedicine increases compliance to treatment. And I will show how this one helps using the integrated devices as well as the set trackers for different diseases. I will explain in one of the next slides upcoming. Of course, it's very efficient, and that is it reduces wait times and travel times, and you can have complete access of your electronic health records online and offline, which is ideal. A lot of the time, patients may be taking a lot of the same drug because they move from one doctor to the other, and just with a change of the name of the drug, they may be taking double because there's no continuity within their care. This platform offers an integrated electronic health record that makes it seamless for us to be able to get the data streamlined, as well as get it more efficient with the communication. Even within our referral process from one doctor to the other, it comes in very handy. And of course, it reduces costs by way of travel time, travel expenses, and time just to meet the doctor. We started off SpectraCare, which is our platform, last year towards the end, and already we have footprints in various locations in Ghana. We have quite a number of doctors sign up, both general doctors as well as specialists, and we hope that after this presentation, we'll get more doctors to be able to be accessible and also give access to our patients across the country and beyond. So just a bit of our solutions. So on the telemedicine platform that we have, it's very convenient and easily accessible. The platform is seamless and you are able to navigate easily. One of the main strong points is using it for chronic disease management, for remote monitoring of diseases, as well as for urgent care through virtual video consultations as well as text consultations. And then it comes with integrated devices, which I'm going to elaborate significantly on. And then, of course, the mental health space is something that we all need, and so is strongly represented. We have a star-rated 6-in-1 device, which is able to track 6 vitals, and that is integrated within the platform. So once the patient has it with him anywhere at home, at the office, you can track these modules. So that includes blood pressure, blood sugar, oxygen saturation, heart rate, as well as ECG. I think I'm leaving one of them in. Let me just see. Okay, I'll come back to that as we go on. This is a sample of our telemedicine platform. On the first slide that you see here, platform, that is what the patient sees once you open up. And so here you have a list of the health conditions that the patient is supposed to input, medication that the patient is on, allergies, hospitalizations, previous surgeries, vaccinations, as well as previous consultation notes that has been done. And then, of course, contact to emergency caregivers, as well as emergency contacts that you may know. And then, of course, we have the provider space. And this provider space gives access to the doctor, gives a little bit information about the specialty so that patients can log on and find. If you also need to refer a patient on the platform, you can select the doctor and do the referral seamlessly. We have on the platform at least 55 trackers, and that spans from the base vitals, including blood sugar, blood pressure, oxygen saturation, ECG, temperature. But if, let's say, patients have chronic diseases, including, for example, prostate, so PSA is abnormal, the patient is supposed to, can enter these vitals, their hemoglobin, BUN, so that remotely at any time, you can actually tell what is wrong with the patient. And usually when a tracker is entered by the patient, the doctor who is treating will get an alert. So as the patient, by text as well as email. And it's also programmed that if you set up a parameter for the patient, and it goes beyond the level you set, there's an alert in that on that score, so that the doctor is able to relate and get to the patient either by text or by phone call or by messaging as to what is wrong and maybe how to rectify it. And I tell you, this is very important. A lot of the time, we have most of our patients come in, they're being treated for hypertension. They come to the clinic once, and then they will wait till the next 6 months to have access. In between, sometimes the drug is not working or the blood pressure is not doing well, and they tend to have strokes in between. And we say that the patient is being treated, is on his drugs, and they still have a stroke. A lot of the time it's because they are not compliant. Because the system allows you to, and the patient to monitor these. When it goes off track, the doctor sees, the patient sees, and so it has major impact on mortality as well as morbidity. The platform has major security, and there's a page to it that I'm going to talk about. We have all our doctors are licensed across, and they are also with the MDC accredited. So if you have to come on, you have to sign in up. We make sure that you are completely accredited, and that process is only done by us on the back end, so that we don't have quacks or unlicensed people to come on the platform. So once you come on, rest assured the doctor you see on has the necessary credentials to see you. It has the remote monitoring tools. It has appointment reminders. So for example, if an alert is usually given before an appointment. Usually you get it, the patient will get it 24 hours before the time, as well as 30 minutes just before the time. If a tracker is supposed to be entered, an alert is given 30 minutes before. Once the tracker is entered, you also get an alert. And there's secure messaging. It also allows us to be able to give information on health education resources. It has a complete report of the patient's medical history, is able to do e-prescriptions as well as health trackers, and also generate request forms for both labs as well as medical imaging. Now, a lot of people have concern with data security. I can assure you that our platform is enterprise grade and it is protected. Basically, it has almost everything that makes sure that if you are not a doctor assigned to the patient, you don't see the data. It's role-based access, as I said. So the doctor who have access to the patient is the only one seeing the data. The data is stored and backed up in the cloud many times. So losing data is something that we make sure it doesn't happen. It's HIPAA compliant. And if anything we have to do, we have not started yet, but maybe later we may want to consider maybe research in that respect, assure that all the data will be anonymized. And then, of course, we do regular security audits to make sure that everything's secure, encrypted, and protected. So rest assured that is done for the security and making sure that patient data doesn't get to where it's not supposed to go.
Yeah.
So on this slide, it shows the 6-in-1 device, which shows this device here. It has a regular cuff, and we are able to take the blood pressure, heart rate, blood oxygen,
So the
body
director of
temperature,
research based on guy
as well as
for Yankee.
ECG, and
Dr. Frimpong, you're muted.
oh, from when was I muted? Should I go back? Okay, I should go back. Sorry about that. Okay. All right. Maybe I'll just recap from the data security. I don't know how I got muted, but saying that it is embedded, this is an enterprise-grade software, backed up many times in the cloud, and we make sure that the data is protected. There's role-based access, which means that the provider is the only one who should have access to the client's data. And so nobody sees what you're not supposed to do. All the communication is encrypted, very secure, and our data is HIPAA compliant. There are also regular audits of our data, so for sure, data is well protected. On this slide, it shows our 6-in-1 device, which comes with a regular pneumatic cuff and is able to take correct measurements. The device is accredited by the FDA in the US, in Ghana as well as Germany TUV. So you are sure the readings coming through are correct. And so it is able to do blood pressure, blood sugar, oxygen saturation, body temperature, as well as ECG and blood glucose. I'll demonstrate it by the time we finish. On this slide, it shows a reading from the blood glucose from a patient, which showed the different colors. On the right side, you have blue representing fasting, post-breakfast, pre-lunch, post-lunch, pre-dinner, post-dinner, bedtime, 3 a.m., as well as random. And it's all color-coded. So with this one, the patient had a normal glucose at 6. The next one in the following month, April, it came as high as 9.5. And after that, it's been controlled since. There was one random blood sugar checked, which was, I think, around 8.5. And so depending on what you want to show with the patient, you can have access to it. As I said, I'll show this one later. This is how the blood glucose monitoring works, and then it's easy to do. Now, apart from this blood pressure, this is 6-in-1 device, we also have higher end peripheral devices, and that is also integrated. So we have a digital otoscope, which is able to listen like a regular device. So you can use it to listen to the heart sounds, the lung, as well as abdomen if you are suspecting obstruction, the bowel obstruction. Usually, if you have to measure that, it requires silence, otherwise there's interference. And then we have here digital otoscope, which you are able to have high-grade HD images of the tympanic membrane. You can use it also for evaluation of the throat, the nose, as well as, because it's able to take very good images, is excellent for dermatology. So you can review skin lesions remotely. So it's actually very ideal. And then, of course, so basically it's about the devices. I'll come back to that. For us doctors, it gives us opportunity. So we spoke about it. We've been thinking around it to see how we integrate it within the community. And we've looked at these spaces. So it means that if you're a doctor and you are signed on, you can actually have access to a lot of patients within the community. The first one we've started already is looking into the corporate space. And for the corporate organizations, for sure, they want to save time, prevent absenteeism. And so coming up, you'll be seeing a lot of these spaces coming up where they will have these devices within the office space. So when somebody is sick, and if you're a doctor who's available, you can have access also to treat them. We also have the school e-health program. And I keep saying that until now, most of us in schools, particularly second cycle schools, their sick days are managed by nurses. I think that it can be improved with having a physician on site, a physician remote to help the nurses take a more optimal treatment of these patients. Also for us specialists on the platform, we have a plan called the TrueSAP, which is a telemedicine rural specialist access program, where if you are a doctor, you can, a specialist, you can remotely see these patients within their own clinic space. So it is planned that for these practices coming on board, there will be a consulting room with the necessary devices, including the 6-in-1 device, the otoscope, and the stethoscope. So you can have complete remote evaluation of the patient, maybe about 90 to 95%, getting all your vitals and findings whilst not being there. We are also working with some of the pharmacies to have consultations done within the pharmacy space. A lot of the time, we did a market research and realized that about 39% of the cases, patients go to these pharmacies as their primary source of care. So that is an access point for us healthcare providers to be able to optimally see these patients. And of course, we have individuals and families that we can get to. So coming to my first part of the presentation, for us doctors, these are the packages that are available. One, through the remote monitoring, and I'll speak a little bit about this. So let's say a patient has hypertension. This patient doesn't have to come to the hospital to get monitored. If the patient has the device at home, you, the doctor, can plan out the monitoring. So you can start with maybe weekly BP checks. The patient checks it out. You can program into it maybe every quarter or every 6 months to have the blood urea creatinine done. You can remotely do that. You can plan into this programming maybe once a year eye check, so that the patient is optimally monitored and doesn't have to come to the hospital because of that. Paulina will talk a little bit more about that. There are subscription rates for the doctors on the platform. So if the patient sign up over a year, and then it is within the year, the doctor is supposed to have at least 4 presentations. for video consultations, as well as some text consultations with the plan that is done. Then, of course, we have the on-demand consultation by other general practitioners as well as specialists, and then the sale of our integrated devices. I think that is the end of my presentation. Paulina will continue with how to optimize the chronic disease management. After that, Catherine will look at how, as doctors, we can sign up on the platform. Paulina, thank you very much.
Hey, Dr. Frimpong.
Good evening, everybody. Thank you for joining us today. I'm Dr. Paulina Mensah, and today I'm going to walk us through a little bit of how the monitoring plans are created so that doctors who come onto the platform would see the various options they can have for their patients. So as a provider on the SpectraCare platform, you can sign up your patients to any of these monitoring plans. As you can see on the screen, there are some that are already live. We have a few subscriptions already with patients updating their trackers so that the providers they are assigned to can monitor and provide feedback. So I created a dummy plan that would sort of that will be used for today's demonstration. So we are calling this the Smart Diabetes Care Plan. We've not assigned any patients yet for the purposes of this presentation. So when we come here, if we had patients, you would see the list of the patients that are logged in on this plan. So as a provider, you can see the patients that are on this plan, and then we come to the plan details. As you can see, for this plan, this is what our patients would see. Welcome to the Smart Diabetes Care Plan. We aim to take the stress out of diabetes management so you can fully live a life of health and wellness. We understand that living with diabetes can be challenging, which is why we provide personalized support to you every step of the way. With regular screenings and reminders, we ensure that all aspects of diabetes care are taken care of, including comorbidities, medication management, lifestyle modifications, and more. We work with you to develop a comprehensive plan that suits your unique needs and goals. So as a provider, you can tailor this to suit your patient. So when we come here, we can see that, for example, I have set the patients, as a provider, I've set the patients on this plan to update their blood pressure once daily at 8 p.m. The blood sugar daily at 7 a.m. And then when they do the lab, so for the blood urea nitrogen, we're doing it quarterly, right? And the patients would update their tracker according to this plan. So they would get reminders on their device telling them to update their tracker. 30 minutes before 8 p.m., they are going to get a reminder to update their blood pressure reading. And I would then review it every month, right? And so when it comes to the blood urea nitrogen, I would review it annually. So I would get a graph of what the patient's trackers have been anytime they update it. And so this is a good way to keep track of how your patient is doing. There are different labs on here. There are different trackers. We have the ECG. We even have exercise. We have hemoglobin, HbA1c, even the height, the mood. So it's very comprehensive. There's sleep, there's pulse, then these are the liver function tests and weight. So you and your patient can decide how often you're going to update the trackers, and you can tailor it for different patients. So you can create different plans for different patients. And there's a section for general instructions that would show if you need to give the patient further information. So there's just a sample there. And then there's the pricing that would also show. Then there's a frequently asked questions section that answers any questions that your patients might have. So for example, maybe a patient might ask, so what guidelines is this monitoring plan based on? And there's the answer there. So you can add a couple of more questions. So yeah, that's that. And then we come to the monitoring team. So for the monitoring team, if this is a group practice, or if you want other specialists to weigh in on the management for your patients, you can add them to the team, and they can also review the trackers, review the patient's graph, and you can take collaborative decisions for the management of the patient. So this helps in integrated care. So basically, that's that. It's very easy to set up a monitoring plan. If you need help, there are people to help. So it's a great way for providers to keep tabs on their patients remotely. Yes, I think that's it. If there are any questions, I'm sure at the end of the entire presentation, we will take them and go in further. All right. I would let Catherine take over.
Good evening, everybody, and welcome again. I'd like to know if everybody can see my screen and if everybody can hear me, please. Hello.
Yes, Catherine, we can see your screen.
Okay, thank you. This evening, I'm going to take you through signing up on the SpectraCare app, what it entails. I'm going to share the SpectraCare interface, as well as how to go about virtual consultations and in-app communication, how to manage appointments, and also my contact information if anybody has further questions that would like to be asked after the presentation. So for verification, we require that every doctor that likes to be signed up onto the SpectraCare platform provides their MDC number, so we're able to cross-check and ensure that every doctor that is signed onto the platform is in good standing. Then we require a preferred email, the preferred phone number, the doctor's designation, your availability per patient in minutes. So with regards to this has to do with how many minutes you're willing to see a patient for each consultation. So for example, you would like to see each patient for either 20 minutes, 30, 40, 50 minutes, whichever minutes you are willing to take for each patient. Then, as well as your consultation hours and days on the Spectra platform. So this has to do with the days that you would like to consult, whether each day in the week or on some days in the week, as well as your consultation hours. So, for example, you would like to consult from 6 a.m. to 6 p.m., or you would like to consult from 7 to 8 a.m., whichever hours works best for the doctor. Then a clear headshot of the doctor to create a profile picture for the doctor on the platform, as well as the full name as you would like the patients to see. So once all these details are given, the profile is set up for the doctor, and the doctor can access their account directly through the web on www.providers.spectracare.io or on Google Play Store as Virtual Practice Healthcare. And this is the interface for the Google Play Store. Then the last interface is the interface for Apple users, same as Virtual Practice Healthcare. So when the setup is complete, an email is sent to the doctor, and the doctor does follow the instructions that are sent to the email. And the doctor is led straight to the website www.providers.spectracare.io. So then, after following the instructions, this is the interface that you would see. So you input your email address, and for a first-time user, you would have to create your own password. So you would have to go to forgot password at the bottom of the screen over here. And then if you're a continuing user, you just put in the password that you have set and then you sign in. So when you sign in, it loads and then it gives you the interface for a health provider. So I'll take you through the interface for the health provider, the main dashboard, the different navigation features we have, how virtual consultation can be done, the in-app communication tools that we have, and how you can manage your appointments. So in signing in, this is the first thing you would see. You would see a list of patients on the platform on your screen. So at the top right corner, we have the notification bell and we have the profile of the doctor, which comes with the picture. Then here to the left of the screen is the list of patients, the appointments, your video consults, your monitoring plans, your text consultations, your consultation notes, your prescriptions, your lab orders. So all of these are self-explanatory, and once you tap on them, they are going to show you what exactly it entails. So I would quickly run through the consultation notes so we see how we can go about that. So for example, if you have done a consultation with a patient and during the process you did not put in your consultation notes, you could quickly come to consultation notes, and in here you will be allowed to log in a consultation notes for the particular patient that you saw. So for this, you click on login consultation. The health provider's name is put in there. You can select the type of consultation. In our case, it will be a video consultation or a remote monitoring follow-up, a patient question follow-up, or a medical report follow-up. You then put in the
Catherine, we can hear you, Catherine. We can hear you. Catherine, please, we can hear you.
Hello? Am I being heard, please?
No.
Yes,
Hello?
No, the audio is very bad.
Hello?
Catherine, you're back online.
Yeah, we can hear you.
Good. And
Catherine is muted.
hello, everybody. Sorry for the inconvenience. Am I being heard now, please?
Yes.
Hello?
Yes, Catherine, please continue. Yes, you may proceed.
Okay. So in logging in at consultation notes, you put in the patient's name, and there's a drop down that could quickly be used in order to fill up all the other spaces that are needed. So from here, you can go down and put in your review notes and make it visible to the patient as well, or not. You can further add a prescription if you would like, and a lab order if you would also want to add a lab order. When you're done with this, you just have to save, and everything will be saved on your platform as well as for the patient as well. In cases of an emergency where a patient hasn't done a booking or a doctor hasn't done a booking and the patient will need an emergency consult, this icon on the top right corner, known as the waiting room, can be used to invite a patient to have an emergency consultation. So with the waiting room, you can invite the patient to the waiting room by clicking on this icon and then putting in the patient's name. So when you invite the patient to the waiting room, an invitation is sent to both their email and through their phone, and they can access this quickly through that, and then a consultation can take place for the patient. There is also the text consultation, where you can have a consultation with patients through text. You can have a consultation with a patient through text. And over here, we see some consultations through text that have gone on over time. So with regards to the appointments, once a patient sends in an appointment, the appointment comes through the notification bell. The doctor has to go through the notification bell, and every notification is found on here. So a doctor has these options to either reschedule with the patient or confirm for the patient. Once confirmation is done, the consultation can happen at the time and the day that has been scheduled. So for now, this is all that we have for now. You can contact me on 050-767-6869 or Catherine Dobido at strl-inc.io if you have any other information. Thank you.
Thank you very much, Catherine. We'll go to the next presentation, and that is building a thriving business. That is after that, we'll look at the business aspects, and then we'll give ourselves about 30 minutes to answer some of your questions and queries. Eunice, please continue.
Okay, thank you, Dr. Frimpong. So I'm waiting for my screen, my slides to be shared. But thanks for the initial presentation to all the presenters earlier on. I think a lot of the work has been done for me. Okay, Dr. Frimpong, the slides to be shared, right?
Eunice, I'll share your slides, please. Kindly give me a moment.
Okay. Okay, thank you, Catherine. So I'm very passionate when I'm talking about telemedicine, mostly because of findings from a recent, research that we just conducted, and very interesting data we got. So maybe before we even go into looking at how we can build the thriving, telemedicine platform, let's just take, a quick look at what the current situation looks like. And over here, you realize that most of the factors that are currently existing, okay, or the current situation points to the fact that there is a rising demand or need for telemedicine solutions. Today, let's think about it. There are many regions in Ghana, in Africa, that has very limited access to healthcare. Care is delayed, patients have to travel long distances before they can access certain, specialist care. And this, affects the treatment outcomes, or even, mortality and morbidity measures. It will interest you to know that, telemedicine has been projected to grow at a compound, interest growth rate of, I think, 27.5% from 2020 to 2027. And today the question is, are you going to be part of this growth or not? And, like I said, from the study that we conducted recently, we found that about 62% of respondents cited cost, convenience, and delays at healthcare facility and distance to the nearest facility as key barriers to access and healthcare. Now, what this means is that there are people that know, maybe for one reason or the other, they need care, they need to seek care, but these barriers are preventing them from seeking care. And there's a lot that we can do about it with our telemedicine solutions. Now, we all know what digitization has done, how it's evolving, how it's changing the world, how it's affecting our patterns, the way we shop, the way we interact. Everything is digitized now. There's increased cell phone adoption as well. Almost everybody has a phone now, right? People want convenient solutions, want digital solutions. Okay. There's evolving consumer patient trends, and we'll all attest to this fact that now patients come and they are demanding for innovative and novel techniques. They are coming informed from a place where they're asking you questions. Oh, I read about this, I read about that. What do you know? What do you think? So patients are coming demanding for things. They are coming from a more informed place, and they are looking for more convenient solutions and innovative solutions. And we are now in a better place to provide that. And to top it all, as Dr. Frimpong said, COVID-19 has highlighted the importance of telemedicine, forced us to use technology, and change our ways of doing things, which in a way has been good as well. So in every sense of it, you would realize that telemedicine is a win-win for all, whether you're a patient, you're a healthcare provider, or you're a payer. Whether you're an insurance or even government, you realize that in the long run, telemedicine comes in as a win-win for everybody, right? So for the patients, the convenience is something that most people are looking for. Like I said, 62% of patients say they won't go to the hospital because they find it too long to wait, or they find it too long a distance to travel, or, some are just not, very interested in going to the hospital for one reason or the other, for the cost or for whatever the reason is. Then again, the fact that we can reduce healthcare costs for some patients by eliminating the need for in-person visits, okay, cost that comes with having to travel long distances. Some people travel all the way from one region to the other to seek care, and this can reduce, that total cost of treatment can reduce with telemedicine. For the healthcare provider, there's also that convenience aspect for you where you can support home health care. For you also reduce travel and associated risks for the physician as well. I mean, you can be on a vacation and still have your consultations done from wherever you are, and still make extra money for yourself. You have access to the electronic health records, computerized comprehensive data, like we have seen, from Dr. Paulina and Catherine. You have access to a whole lot of information, from your computer, whatever device you're using. There's quick and timely follow-up on patients discharged after palliative care. You have improved diagnosis and better treatment, of course, which is supported by the integrated device that we have. And then also overall overhead costs for those of us that are running our clinics are reduced in the long term. You don't need to, make room for certain costs to accommodate the numbers that will come to your clinic because you are now seeing patients, some of your patients remotely. For the payer, there's significant reduction in unnecessary visits, hospitalization for specialized care at tertiary hospitals. There's earlier discharge of patients, leading to shorter length of stay in the hospital, and also increase in the scope of services without creating physical infrastructure in remote hospitals. So now, having seen that, there is a need, of course, clearly there is a need for telemedicine. There are benefits for all of us for telemedicine. The question now becomes, how do we incorporate it into our practice? Okay. And there are four key steps that, I can assure that if we follow, it will really lead us to having a very thriving telemedicine practice. So the first of all is our mindset change. And I'll talk about what that means. And then we're going to look at incorporating into telemedicine into our routine operational mode, optimizing our teleconsultations, and also managing the potential risk. So I'm sure we will all agree that change doesn't come easy, no matter how big or small. Change is very difficult because we are used to doing things in a certain way. We form certain habits, certain patterns where we know when I move from here, I get up, I go there, I come there, I see this patient, I come back. So it will really require an intrinsic shift from what we are used to, the traditional, well-accepted methods of patient care and medical practice, to new, unfamiliar, yet tried and tested ways of practicing, right? And this is so important because that inertia to change can be very difficult to do, from the start. But once we are, taking steps little by little, we can have that mindset change. And that affects our overall perception and willingness to adopt telemedicine. And we'll see that once we as healthcare providers are beginning to embrace the telemedicine, it will trickle down to our patients as well. So this is how you can, help yourself, with that mindset change. First of all, think about all the potential benefits of telemedicine, all the patients that will call you and say, oh, I'm stuck in traffic. I'm sorry, I had to do this work. My boss called me, so I couldn't come. And you are there sitting there and waiting for the patient. Think about all those patients, the consultations, and the money you'd have lost, for such patients who would have graciously embraced telemedicine. People. Because there's no, look at how for you can have extra time on your hands to breathe and have a bit of time on virtual consultations. Then again, it's very important for us to involve our team. So for those of us that work, of course, with a team, I'm sure almost all of us, we would need to involve our team to educate them about telemedicine, the benefits and the new changes that, are going to happen with the incorporation of the telemedicine, and also manage their perception towards embracing telemedicine. Then lastly, to have a roadmap of how we will be incorporating telemedicine into the practice. And, I always advocate for small, stepwise, incremental changes, because this is how you'll be able to change ultimately. And so how do we incorporate telemedicine into our routine operational mode? First of all is by enrolling on the right telemedicine platform. So today, there are a lot of telemedicine platforms that, you have a choice to choose from, but which one will support your goals? Which one will support your clinic needs and help you communicate or engage your patients effectively? Which platform comes in, with that HIPAA compliance and data, security to support your, communication with your patients. So today, what we are saying, and with all that we have shown, is that SpectraCare Telemedicine platform comes in as the leading platform for you that support your clinic needs and your goals, and will enable you to connect with your patients and provide personalized care remotely. So here's the link to the application. You can find it easily on either Google Play or App Store. You can access it via this link. And then again, you can reach out to our client relations officer also to support you with the onboarding, as has been highlighted. Then the next step will be, like I said, integrate your staff. So it's very important that you share your vision, your goals, you share with your team why the change, why are you incorporating telemedicine. Let them also understand, why we are, beginning to incorporate telemedicine, so that they can also begin to advocate and to recruit patients and identify patients that will potentially benefit from the telemedicine. Then set up a dedicated system like we already have, as we do with our normal operations with the traditional medical care and practice. Let's have also a dedicated system to schedule and manage telemedicine appointments. Set up your profile to reflect your available times, as Catherine has said, and we are here to support you as well. Run test sessions with your staff or willing patients just to get a feel of how the platform works, and for you to get the opportunity to resolve any technical issues before conducting actual telemedicine visits or consultations. And then lastly, create awareness, communicate to and educate your patient. So one thing we found out was that a lot of patients are interested in using telemedicine, but because it's a new concept, because they don't know much, a lot of people are saying, okay, we want to know how it works, we want to actively but for you in your own inner circles with your patients as well, you could use the opportunity to educate and inform your patients about the availability of telemedicine services, educate them about the benefits, the role of integrated devices, as we have seen, the 6-in-1 device, the digital otoscope, and the others that will help, make consultations smoother. And also with that education, what we hope to achieve is to bridge the knowledge gap and improve acceptance of telemedicine. So today there are various channels that you can leverage. Website, your clinic website, your social media platforms, your clinic signages, you can put it there that you offer telemedicine, or you can engage patients remotely to promote, these telemedicine options, and also to increase your reach with your patients or potential patients. So we've said so much about the features. I wouldn't go over it again. We have so many features that is very unique and differentiates SpectraCare from many other telemedicine platforms that currently exist. And, for that matter, comes in as your number one, choice when it comes to telemedicine platforms to enroll on. The third point is to optimize your consultations. And with that, we're looking at, first of all, identifying and engaging potential patients. So potential patients can come in so many forms. First of all, like I said, even if you sit down and look at all those patients that miss out on their appointments, patients that complain, those patients who will call you and, start saying, Doc, can I speak to you for a minute? I want to. And I know that we all don't like that, right? We don't like patients calling us ad hoc and then, beginning to discuss, because they think they don't have the time. It's the convenience for them. These are all patients you can begin pitching telemedicine to and to schedule appointments with. We're looking at new consultations. You can get new consultations from the app once a patient looks and wants to have a consultation and you fit their profile, they can just schedule a consultation with you. Whether you are a general practitioner, you're a specialist, there's room for everybody. Then for your chronic diseases as well, for your reviews, for your remote monitoring, SpectraCare offers that opportunity for you to embrace all these patients as well. For preventive health and wellness, today there's so much focus on men's health, women's health. Women and men, we all want to know that we are healthy, at various stages. What are the things should we look out for? You can carve out a package for your patients and put them on that preventive health and wellness package to help support their health goals, okay? And, for patients that are at certain risk of certain conditions, maybe due to their family history, we can put them on a remote monitoring plan to help monitor their health and to prevent the occurrence of such conditions. Then secondly, is by enhancing your patient interactions. So there's so many things that we can do during the interaction with our patients to make sure that we're enhancing their experience. First of all, for you as a provider, planning and preparation is very key. So one of the things you can do to enhance your teleconsultations is to prepare ahead of time before your appointment. You can review your patient's information, medical history, and notes before the consultation, so you can have a more focused discussion and during the virtual consultation. Then also you can enable virtual waiting rooms. So the platform, SpectraCare platform, enables you to have virtual waiting rooms where patients can check in and wait for their appointment times. And that also helps you to manage your schedule effectively and promptly attend to each patient. And of course, we've seen how our platform operates. You have access to the health records, very comprehensive health records for your patient that supports your engagement and diagnosis as well. Then you also can make use of all the tools that we have. Some patients prefer using the text consultations, others will want the video, others will want voice only. So depending on the patients you're engaging, you can utilize all these telemedicine tools to communicate effectively and to cater for the different patient preferences also, and also optimize the consultation process. Then again, time-saving strategy. So it will be very good that you set a time limit for yourself. Also to look at how you can encourage your patients to prepare also adequately so that you don't waste too much time on the consultation and just provide the necessary medical advice. We have telehealth consultations that have pre-built telemedicine, streamlined documentation processes and questions that you can use to, first of all, engage your patients. So again, you can streamline the consultation process and also save some time as well. Then lastly, we all see how the integrated device comes in to make the whole consultation process much enhanced because you're having real-time access to the patient's vital signs and data. So again, that comes in to enhance your interaction with your patient. Then we do know also about the perceived or potential risk, whether they are real or not. Of course, we have to be aware what the risks are and how we can manage these risks. So the first one is the financial risk, where over here in Ghana, everything comes to cost, right? Where, I know that patients will say, oh, we know it's good, we know that, but then it's the cost. Good thing for us is that, our pricing is very, very competitive. And so over here, in most cases, actually, is for us to even demonstrate how the patient cuts down on cost, right, when they're using the telemedicine option, because now there's no cost associated with travel to the clinic, and all the patient has to deal with is the consultation fees, and of course the usual labs or any other fees that comes in. But in most cases, patients will need to understand, and we need to communicate effectively what the benefits are and the value of telemedicine solutions are, so they appreciate that they're spending its value for money for them. And then in the long term, the return on investment, also patients need to appreciate that this is an investment into their health. It's it's the right way, because today health seeking behaviors are very, very low, and in most instances, like I said, the barriers that prevent people from accessing health are things that can be dealt with telemedicine. So in the long term, people are much healthier. They have better health outcomes as well. Then with time risk, where sometimes if we haven't, taken into we haven't taken into account some of these risks that could potentially lengthen our consultations, can come in as a barrier. So one, prepare in advance, you employ the pre-visit questionnaires, allocate specific time slots for each visit, and also avoid time wasted by establishing consistent and reliable means of internet, right? We know internet sometimes can be unreliable, but of course we all know that one probably option that we can use to and have a more secure and stable internet connection. So establishing that beforehand also can help shorten your length of consultation. Also allocate short breaks between virtual visits to refresh and recharge. And this also for you as a healthcare provider will prevent burnout and ensure that you provide focused care for each patient. The other risk that we may have to deal with also has to do with the social risk. So because of how, telemedicine comes in as a new concept, and most people will be looking at, okay, who is using telemedicine? Sometimes if we have the opportunity, we can employ the use of role models, maybe, how do we call it? Social media influencers, I think that's the name, yes. And people to sort of enhance the image and encourage people to implement or to adopt telemedicine solutions. We can also share patient testimonials to show to others that, oh, this one has tried it, this is the experience, and so maybe it's not bad, it's something I can also go for. Technology risk, again, today we have a very user-friendly platform, very easy to use. Process is not complicated at all, and so it's something that is very easy to adopt for you and for your patients as well. Also, to assure patients of the various safety features, like Dr. Frimpong highlighted, that comes in to protect their data and to ensure that all the communications and their health information data is well preserved. You also have a whole team from SpectraCare that supports if there are any technical issues, we have a technical team that is on standby to support you adequately. Again, lastly, for security and privacy concerns, today we are second to none, right? So we have a very robust platform that is with security features, data protection and security features to ensure that your engagement and interactions are well protected. So in conclusion, when we talk about building a thriving practice, I think that we all will attest to the fact that there's immense potential for telemedicine as a healthcare delivery system, and the ability to leverage telemedicine to also address some of the systemic issues that we are confronted by with the traditional healthcare system. And the assurance that you have from us is that We are dedicated to partnering with you to bridge that gap in accessing healthcare and to support you to build a thriving telemedicine practice. Thank you. Okay, so I believe that we have the last part, which is about how we can diversify our revenue streams and the various revenue streams available with SpectraCare. Okay.
Okay, so I'll be talking about maximizing revenue and patient impact with SpectraCare. Basically, we are going to talk about the money aspect of the whole telemedicine, SpectraCare Telemedicine. So we will look at how we are diversifying our revenues, how we can enhance efficiency in terms of our practice, how we can improve patient outcome. We leverage on the devices and some marketing related issues. So there are 5 source of revenues that we can look at. And the first of them is the consultation fee that we will be getting if we consult on the platform. We also have a chronic disease management subscription, which healthcare practitioners can onboard patients and get revenue from. We also look at the specialist consultation, which comes with a different rate, and remote monitoring services. So these and the health and wellness. So these are the revenue stream that as healthcare providers, we will be getting from coming onto the platform and being active on the platform. Well, looking at the whole tech platform and how it goes, there are a whole lot of ways that is enhancing our practice. And one of them is the reduction in our administrative burden. So when we look at the SpectraCare platform, it gives us an integration of all our vitals, all information that you need about your patient. So you have record of your appointment, you have record of your billing, you are able to streamline all your activities, and that reduces a lot of burden. It also provides a lot of cost savings. You are able to minimize your overhead cost. So in terms of the overhead costs, you will do most of your practice and your activities remotely, which saves us a lot of cost. Then it enhances your productivity. You are able to communicate your report, you're able to communicate to your patient stimuli without the patient directly coming to your facility. So it improves productivity, and for purpose of our patients' comfort and convenience, it promotes their satisfaction to a very large extent. So these are some of the ways that coming to SpectraCare platform will enhance the efficiency of your practice. Then patient's outcome will also be improved. You are able to remotely monitor your patients. You are able to come out with a personalized care plan for specialized situations. So every patient can have a personalized care plan, particularly for the chronic disease management. You are able to be proactive in your health management. Okay, you have a fair idea of what is happening to your patients at any point in time. You are able to get your trend, fluctuations in their vitals. So you are able to make informed decisions based on what is actually happening. Then enhance your engagement. You don't necessarily have to have a face-to-face encounter with your patients. You can do this via mail, via text, videos, with or without the presence. You will be able to engage with your patients. Then you are able to keep track of all your records just on an app. A click of button, you have access to everything. All right, so we've spoken much about the device. It tracks all your vitals. You'll be able to do virtual consultation, comprehensive health tracking. I think we've spoken much about these. So I will come to the revenue aspect. So as healthcare providers, there are three main areas that we are going to make money if we come onto SpectraCare telemedicine platform. And the first of them is selling the integrated device, consulting on the platform, and the subscription income from the chronic disease management model. So, okay. All right. So selling the device is costing 3,300. That is the selling price now. And if a healthcare provider sells one device, he's entitled to a commission of 500 cedis. So we are projecting that our healthcare providers will sell at least 10 devices within a month, which is giving an additional income of 5,000 per month, which is going to be an additional income to what you already have. Then when it comes to the consultation, a consultation on the platform is 300 cedis, and a healthcare provider is entitled to 60% of this, which is 180. Our projection is that a practitioner, a healthcare provider, will do at least 10 consultations per month, and that will give an income of 1,800. So we have an income coming from the sale of the device, which if we're able to meet our target, we will be making 5,000. And for doing 10 consultation on the platform, you also be getting additional 1,800 from the platform. Then we have the chronic disease management subscription, and the target audience, the target patient is patients with chronic diseases, the diabetes and hypertension. Then the package comes with 4 video consultation and unlimited text consultation within a year. All right. An annual subscription for this package is 1,600. And the healthcare provider is entitled to 60% of this, which is 960. We are projecting that healthcare providers can onboard at least 10 patients on this platform every month. And if that is achieved, healthcare provider will be entitled to a commission of 9,600 from the chronic disease management subscription. So give or take, if a healthcare provider is able to sell 10 devices, they are able to do 10 consultations on the platform and onboard 10 subscribers onto the chronic disease management platform, then you are required to get an income of 16,400 per month for coming onto the SpectraCare Telemedicine, which is an additional income that if time is managed properly and the platform is, and you become very active on the platform, you should be able to get at the end of the month. You can do more, and is a very good income. So this is the financial figures of all that we've been talking about. Healthcare providers, you are in a position to send the information of this platform out there, educate your patients about this, then onboard them. And as you do consultation on the platform, as you leverage on this innovation, you'll be getting an additional income. Okay, thank you.
All right. Thank you very much, Eunice and Patrick, for the delivery. At this point, we'll take some questions. Joel, can you help us with those? I think I have some questions here already. Somebody asked that, how is the billing done? I will take it, and if Catherine wants to add anything to it, she can. But basically, the system is seamless, which means that Once the consultation is done and the patient pays, the patient is able to pay on the platform. So we have inbuilt within the platform pay stack, and they can use Momo, Visa, any of the payment platform to aggregate the money. And at the end of the month, the payment is made according to how much you earned. Additionally, for certain specialties, the pricing is not the base 300. So depending on your specialty, that you can set up maybe for those in special needs and also requiring special time for the consultation, the billing can be a bit different, and that can be worked on according to your programming. So basically, that's how the payment is done on the platform. The other question is that how do we serve the illiterates? That is a very important one. So far with our previous engagement, what we do is that I'm sure in every home there's a literate person. So usually if the patient is not able to do themselves, usually the son or daughter will assist, and it is working. So they set it up. What is even more interesting is that if you are doing the consultation, particularly for those that the relatives are abroad, you can invite up to 15 family members to be on the platform when you do the video consultation. And they like it, it's excellent. Their communication is excellent, they are willing to help, and so that part is done. So for those who are not there, for those illiterate population, there's still a way. And particularly so for those within the rural space, because we are thinking about the telemedicine rural specialist access program, this one will be delivered through at the facilities. So within the facility, a nurse will be there to assist the patient to have the consultation. All the metrics will be done, and so that's also another way to do. Also through the Chief Doctor Partner Pharmacy program, we're able to reach the community for those who are also illiterate. I also have a third question and said, can it be, is it web-based? Yes, actually, I even prefer the web-based in terms of the video consultation. It's more stable. The website, once you sign up, is the providers.spectracare.io. I'm sure when you come on, you have access. And so the web-based actually work very well with what we are doing, and it's encouraged to use it. It's more stable. You don't have phone calls disrupting your workflow and the video consultation. So definitely there's a web-based approach to all that. Any more questions? Catherine, you can go on.
I'd like to add, with regards to the billing, for the consultation, the doctor doesn't get the full amount that has been charged the patient. So the doctor gets 60% of the total amount, and then 40% goes to Spectra. So after each month, your bill will be calculated based on the number of patients and the number of consultations that you have done, and then it will be calculated accordingly. I wanted to add that to the billing part. Thank you.
There's another question saying that is the system web-based or it could be accessed offline. Basically, it's online. And so you need internet, a stable one, to be able to access it. So it's online, and that's basically it. The patient will need to have access to the internet. There is no cost. The question is that, is there a cost in signing on? No, there's no cost. It's free. Basically, where the doctor pays is when he does the consultation and the split of the consultation fee. But it's free to sign on as patients. It's free to sign on as providers. Yes, the tax on the income, I'm sure we have to do something on it. And usually we will use the, what is it called? When their consultants pay the 7.5%. There's a name for it. Withholding tax, isn't it? So that one usually will be taken for the government as statutory, but I think it's 7.5%. Prof. Amma, please, you can go on. You can unmute yourself.
Okay. Yeah, this is a fantastic presentation. You can all hear me, right? Good evening. This is a fantastic presentation. A lot of material delivered here. And what my question was is, when would the recordings be available for review?
Prof. Amma, I'm sure we can do it within the next 24 hours. I'm hopeful that maybe you sign on, it makes it easier. So you can sign up, but if you don't sign on, you can send a direct access, and then we can send it to you. But everything has been recorded.
Okay, I'll yes, Dr. Vipa, I'll get in touch with you and to see how I sign up. Thank you so much.
All right, thank you very much, sir. Dr. Kobe, you have the floor.
That's good evening. That's a wonderful presentation. Yes, but unfortunately, I think I joined, went off and came back. So I couldn't get a clear view on how to sign on as a provider. So if it can be recapped or if it will be sent to us later, I don't know, but a quick recap of how to sign on. Thank you.
Okay, Catherine, we did take a summary of it, and after that, you can share with him the slides. But if you can do a brief summary, yes.
Hello, everybody. So a quick review. So the first thing to do is to submit your MDC number. This is to verify if you're in good standing with the Medical and Dental Council. Then you provide a preferred email, a preferred telephone number. You provide clear headshots of yourself. You also provide your name as you would want the patients to see, your designation or specialty. Then you'd have to give us the number of minutes you are willing to consult with each patient. So for example, per patient, you would like to consult for 20 minutes, 15 minutes, 30 or 40, whichever one works best for you, as well as your consultation days and times. With regards to that, that has to do with the days that you would like to work. So either Monday to Friday or throughout the week from maybe 6 a.m. to 7 a.m. or from 7 a.m. to 9 a.m., whichever one works best for you. Dr. Kobe, are you okay, please?
Yes, I'm clear on that. So where do we send this information to?
Okay, so if you would like to on Dr. Kobe, are you ready to take a number, or I could take
Okay,
your
I'm
email
ready.
address? Dr. Kobe, did you sign up, please?
No, I've not. As in for this
So did you
meeting,
sign
or?
up for the seminar? Yes, please.
Yes, I did.
Okay, I would go through the list to find your number and then contact you.
Okay, all right.
Okay.
Thank you.
You're welcome.
So for those who want to sign up, you can send your details to the numbers on the poster that was sent around. So any of the numbers are on WhatsApp. You can WhatsApp us, we can send you the form, you fill the form, and then we help sign you up.
All right, thank you.
Okay, thank you
There
very
is
much.
another question here that says, I'm just wondering if the Ghanaian client is willing to pay 3,000 cedis for the device and still pay 300 cedis per consultation. Please, baby comments. That is from George. Actually, we did a survey on the sale of the device. And for people who are very conscious about their health, they were actually happy to pay between 2,000 to 5,000 cedis for the device. So it's not really a problem. And we made significant sales since we started. Of course, it kind of cuts out maybe the very low income. But the good thing is that this device is one per family. So for a family of 6, they can have access. The other option is that if you cannot afford, you can have the access through either the community pharmacies or through the specialist program for the rural communities that we access. And so we are making it accessible for individuals as well as the communities through these packages. And the consultation of 300 cedis, I think that it is fair. Increasingly, consultations in our country has been going up. And rightly so, everything is expensive, and I guess it's a fair pricing. From our study too, it came out strongly that people are willing to pay between 200 and 400 cedis. And so I think that it is fair so that the doctor too will earn something. It shouldn't be free consultation all the time that we continue to do. I think that that should stop. There's somebody's hand on.
Yes.
Joel. Yes, you can talk.
Good evening. Yes, good evening to all. It's a very good presentation, and it's quite innovative. In terms of starting up, so as a provider, I can just sign up for now, whilst I try to pick on my patients. What I want to know is, from time to time, is it possible to kind of alter my times of availability?
But I missed
often?
that. Please, can you repeat?
How often could I kind of change my, periods of availability for consultation? Because I could, from time to time, maybe. Okay, let me put it this way: how flexible is the provider's availability? Because based on from week to weekly basis, maybe my availability could kind of change. So if I make that available, would that disrupt the system or? Okay, so this week I'm probably free on Monday, Tuesdays. Following week, maybe on. If I'm able to make that available on time, would that kind of disrupt the system?
No, it would not disrupt the system. We would be able to change it to suit your availability.
Okay, that's fine.
Yes, please. So for the consultations, you can decide with the patient when you'll be available.
All right.
Yes. And for the remote monitoring plans too, you can tweak it. So for some patients, you can have more options, or more trackers and more reviews. For other patients, for those, let's say, who are not so sick as others, you can reduce how often you review. So on both ends, it's very flexible.
Okay, thank you.
Thank you. So a question is that, is it 300 Ghana cedis per each consultation? Not exactly. Usually the first consultation, yes. If let's say you request that the patient brings in some lab, and usually the doctor can initiate the conversation once the labs are uploaded. And so the patient doesn't have to necessarily pay. For some doctors, their preference is that if it's a review, let's say in 2 weeks, if maybe the initial charge is 300 cedis, you can make say the next review maybe 150 cedis if you bring in labs for a review. Some doctors too may decide that they won't charge anything, which is okay. So far, we are yet to define the metrics, but we can make it free if it's a review on the same consultation, let's say within a week, when the patient has to bring in some imaging or maybe lab requests for before the treatment completes. So you don't have to pay every time 300 cedis for engaging the doctor. No.
When the doctor requests for labs or imaging reports, and then you upload them on the platform.
Yes. So a question is that if a doctor requests for a lab, can the patient upload it on the platform? Definitely. That's the whole idea, to keep the medical records with the patient on the platform. So once the examination is done, the patient can just upload the results and it's visible to the doctor who requested as well as to the patient. So definitely that is an option that is easily done on the platform. Yes, the doctor can refer to another patient. We are yet to streamline that process. There's another specialist, sorry, can refer to another specialist. We are yet to review that process, but for now, it can be on the platform as a messaging, or we can do a direct referral to the patient to call the next specialist to come on it. But it's going to be streamlined very well in due course. Yes, there's a question, how is the device maintained? Generally, it's a seamless, very stable device. It has 2 years, warranty. And so it's not expected to go that we need the 2 years. If there's a problem, you bring it to us, it will be fixed or replaced. Beyond that, if there's any issue, you bring it to the technical team and we can get it sorted. So definitely there's a back-end support for the equipment, but it's generally a very stable equipment. Normally it's chargeable. So you charge it and then you use it. If it goes off, you recharge. But it works quite well. And the battery life is quite good. When you charge it, I think it takes maybe about a week or two, even with daily usage. So it works very well. It's been answered, okay. Somebody asked, can I please as well get a contact I can make more inquiries from? Definitely. You can have from Paulina, from Catherine, myself, and Eno. We are available online. If you look at the flyer, the contact is there. You can follow it up. Okay, so doctor said that he's wishing that the consultation is lower. Yes, for the rural population who are joining the community through the Telemedicine Rural Specialist Access Program, I think the pricing is 230 Ghana cedis, and that is to cushion the rural population. But for the standard city individual programming, I think that the 300 cedis is fair. But for the rural communities, it comes low as 230 cedis, so that for those who cannot afford can have the access. Any further questions?
Hello, once again. Quickly, Dr. Prepon, is this linked to any of the private insurance schemes?
We are working on that, but they've shown very keen interest. So I'm hoping that within the next few months, most of them should be on the platform. We need that particularly for the corporate organizations. They usually will run on these insurance groups and they are interested. Our study showed that they are very interested. And so over the next couple of months, we should have quite a number of them coming on the platform. So, and the platform gives the access where if you have insurance, but at sign up, you can indicate the credentials for the insurance, and then you can get the approval before it goes through. But that is something that's expected to enroll over the course of the few months ahead, definitely.
That's great.
Any further questions? Which one? The question is, how do other health professionals also subscribe and participate? It's a similar access. So to prevent quacks from coming on board, you still have to go through our client relationship officer, administrative coordinator, Catherine. And then if you are, let's say, a physiotherapist or a nurse practitioner, we need similar credentials to make sure that you are registered and licensed, and also updated on your system that you can provide the care that you want to do. So it's a similar process like the doctors. Thank you. So somebody said, which company makes the device? So that is SpectraCare. We contracted a company to have it done for us. So for now, it's still branded to us. And so if you need it, you come to SpectraCare, we'll get you a device. Thank you. All right. Without further questions, maybe I'll give the presenters a minute or two to just just say something, and then we conclude. But from my end, I'm very grateful for the participation and the interest shown thus far, and we are willing to support all of us to make sure that it succeeds. I think that it's time that we do this well. We don't want to wait for another pandemic before we start scrambling. But before then, we still believe that the impact of telemedicine, particularly with chronic disease management and the compliance thereof, is absolutely necessary. And that is a gap that can never be filled by anything else. And so we encourage all of us to get on board and make this thing very successful. Yes, the recording will be sent to everybody who registered and also everybody who came online. If you even didn't register, I'm sure the contacts will be there for us to get to you. Thank you. Any comment from anybody? Do you want to say something? Okay. All right. It looks like everybody is fine now, and we are very happy to take this one forward and keep engaging. I'm sure you'll be hearing from us the more. We need the doctors, the patients, the whole community to be part. Thank you very much for joining. I think we almost did about 2 hours. And thank you all for coming.
Thank you very much.
Thank you very much.
Thank you very much. Thank you. Good.